Nursing care of patients with nutritional disorders. As these headlines show, Americans are becoming aware of the obesity epidemic. We're trying to help physicians educate the public about the relationship between obesity and a sedentary lifestyle. Causes go from genetic to sedentary lifestyle to environmental factors, physical activity, psychological factors, illness, and age. Obesity is associated with alterations in hemodynamics. An increase in oxygen demand as a result of excess adiposity requires an increase in cardiac output and a parallel increase in blood volume. In the obese person, an abnormal increase in blood pressure is primarily dependent on an increase in peripheral vascular resistance. Obesity results in an increment in total blood volume and cardiac output, caused in part by an increased metabolic demands as a consequence of excess body weight. This results in a heightened cardiac workload for obese people. Frank Starling's curve shift to the left leads to an increased left ventricular filling pressure and volume, which leads to an increase in chamber dilation, which results in left ventricular hypertrophy. To meet these increased cardiac demands, circulating blood volume, plasma volume, and cardiac output increases. This in turn increases venous return and leads to hypertrophy and dilation of the chambers. Other pathophysiological effects of obesity include, but are not limited to, venous insufficiency, venous thrombosis, pulmonary edema, endothelial dysfunction, hypertension, sleep apnea, stroke, coronary artery disease, arrhythmias, and insulin resistance. Pedal edema is commonly found in individuals who are massively obese. This may partially be due to an elevated ventricular filling pressure despite elevated cardiac outputs. Obesity is a chronic metabolic disorder. It is associated with coronary vascular disease and increased rates for morbidity and mortality. Even in the absence of systemic hypertension or underlying organ disease, a variety of adaptations, alterations in cardiac structure and function occur as adiposity increase. Recommendation is weight loss should be about 1 to 2 pounds a week for a period of 6 months. A diet that is individually planned to help create a deficit of 500 to 1,000 kilocalories a day should be an integral part of any program and achieving a weight loss of 1 to 2 pounds a week. Reducing dietary fat alone without reducing calories is not sufficient for weight loss. However, reducing dietary fat along with reducing dietary carbohydrates can facilitate caloric reduction.